here is your question. Not too much to read. You will be able to cover it in 1 minute,
Okay.
hopefully. All right. So if you have read and understood, considering it history-taking station, please begin.
Hello, I am Dr. Hein Tuao, one of the exam candidates. May I confirm your name and age, please?
Yes, my name is Jack, and I'm 43-year-old.
Hello, Jack. Nice to meet you.
Yes, right.
Okay, how can I help you today?
Yes, doctor, I have this pain in my leg, doctor.
Oh, I'm sorry to hear that. So how long have you been suffering for this?
Yes, doctor, for 1 year, doctor.
Oh, sorry to hear that. That is present both of your legs or only one leg?
Please again.
Does this pain present in both of your legs or only one side?
Yes, yes, doctor, in both my leg, doctor.
Okay. So that is a BS suddenly or gradually?
Yes, doctor, it is a gradually started.
Okay. Does this pain present all the time or is it come and go?
Yeah, just when I'm walking, doctors. Just when I'm walking.
Okay. So how long can you walk for this before suffering this pain?
Just for 50 meter, doctor.
Okay. Does this pain present only on your leg or does it move to the anywhere else?
No, only in my leg.
Okay. Could you please describe your pain? Like is dark key or the sharp pain?
Yes, it is aching pain.
Okay. 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 Is there anything that make your pain increase or decrease?
Just when I'm walking for this distance, doctor.
Okay. Does this depend on the that is more severe during cold weather?
Again, please, doctor.
That is severe or worse during cold weather.
Yes, doctor. It's increased during cold weather. Yes.
Okay. Is there anything that make your pain decrease?
Yes. Take a rest.
Okay. Could you please go your pain from 1 to 10, 1 being the lowest and 10 being the highest?
Yes. This is 8, doctor.
Okay, I'm sorry to hear that. Does this affect your daily activity?
Yeah. Not too much, doctor.
Okay. Do you smoke?
Yes, doctor. I smoke.
How many cigarettes per day?
Yes, doctor. I smoke 1 pack per day for 20 years.
Okay. Do you have any numb neck or weak neck or your legs?
No.
Do you have any back pain?
No, doctor.
Have you noticed any changes or your bowel habits?
No.
Okay. Okay. Do Do you have any similar problem before?
No, no, doctor.
Okay, so do you have any underlying medical problems?
So I have hypertension, doctor.
Okay, so is there any medication are you taking for this?
Yeah, just antihypertensive drug.
Okay, apart from this, is there any medication you are taking
No,
regularly?
no, no. No, no, no.
Do you have any allergies?
Just for penicillin, doctor.
Okay, thanks for letting me know. Okay, do you drink?
Ask
No,
question.
doctor, just smoke.
Okay, do you exercise often?
Yes, yes, doctor.
Okay, do you eat a healthy diet regularly?
Yes, doctor.
Who do you live with now?
With my wife.
Okay, what kind of job do you do?
Again, please, doctor.
What
What
kind
do
of
you do
work?
for your living?
Yes, I'm a teacher.
Okay, do you suffer fever recently?
No, no, no.
Okay, do you have any changes in your appetite?
No, doctor.
Okay, so how do you think the call is?
I don't know, doctor.
Okay, so what do you hope from it?
What?
Or what do you hope from us to do for you?
Yes, just to relieve this pain.
Okay, okay, I appreciate your concern. We were discussing with our consultant. We were trying our best to cure your pain. Okay,
All right. Can you
Yes,
please
yes.
summarize your history now? Thank you.
okay. Mr. Chia is a 43-year-old male. He complained of uh, he complained of the severe in his problems for about 1 year.
Yes.
It's a beer gradually. He can walk up to 50 meter. It's more severe in cold weather and released by rest. Uh,
Yes.
he also has the underlying hypertension. He is a smoker and smoke one pack per day. He
Yes.
also has the underlying hypertension.
Yes. So what are your provisional and differential diagnosis for him?
My provisional diagnosis is atherosclerosis.
No,
uh, Acute limb ischemia.
can't
Most
you? Okay. All right.
okay.
Yes. And differential
Depression,
diagnosis?
neurological problem,
Yes.
uh, or deep
And
brain thrombosis.
all
Uh,
right. So how do you plan to manage his what investigations do you think of doing for him?
okay. I want to complete my. Uh, I will do full clinical, full neurological, full neurovascular examination of the lower limbs. I will do angiogram, CT angiogram, MR angiogram, and tubeless ultrasound scan. And then I will check baseline investigation like full blackout, ESR, CRB, and lipid profile.
And anything
Including,
in particular for the leg?
pardon?
Anything in particular for the leg, like atrial duplex or CT angiography or MR angiography or anything? Okay, what treatment can you offer this patient?
Uh, I will, for the medical, for regarding, I will manage in a multidisciplinary approach. For medical treatment, I will prescribe a lipid lower agent and
Okay,
antiplatelet like aspirin or the clopidogrel.
yes,
For surgery, I will consider bypass surgery, stent or the amputation.
okay. How would you differentiate between spinal and vascular claudication?
Uh, I will differentiate with clinical feature
Yes,
like it is in vascular problem. It is worse by walking or the, climbing a hay.
yes,
It's worse in the cold weather. In
yes,
neurological problem or the spinal problem, it can be released by going at here.
Yes, and
In neurological problem, there will be the lower limb numbness, weakness, and
all right, good.
problem.
Okay, blah, blah, blah. Good. Time ended. Thank you.
Okay.
Right.